Another contemporary issue with the potential for a sea change in our profession is telepharmacy. For after all, IMS research tells us that they expect a 6-fold increase in the number of patients who are using telehealth for their patient care needs in the next 5 years. So, what does this mean? And let's think about 2 pharmacy fundamentals. I'm going to introduce the term telemedicine to you, which is the use of medical information exchange from one site to another via electronic communications to improve a patient's clinical health status. This is as defined by the American Telemedicine Association. That association goes on to tout some benefits of telemedicine. They suggest, for example, that it would simply improve access, and particularly to remote locations. And we're going to see some examples of that in a few minutes. So if I'm living in a place in the country or around the globe where I may not have access to the care that we have in a city or in a kind of a more populated area, for example, having telemedicine could be helpful. Also, there are cost efficiencies. We know that we can better manage chronic conditions perhaps in this way, and we learned already in our course that chronic conditions consume about 75% of our healthcare spend, so that creates a cost efficiency if we manage that better. Perhaps we can share staffing, and maybe a pharmacist or a physician or a healthcare provider of any sort could provide care to patients in various settings without having to travel. So there are cost efficiencies. The American Telemedicine Association tells us that they can improve quality of care through telemedicine, and that we would provide comparable care across all conditions, but particularly with regards to mental health treatment and regard to critical care, that even the quality might even be better. And then finally, they suggest that patient demand will help us to drive telemedicine because patients simply want it and are satisfied when they get it. Another kind of related term that, there are lots of terms in healthcare in general, but when we think about telehealth, telemedicine, telepharmacy, there's lots of terms that people use. Another one is mobile health. And this is the use of mobile devices and global networks to deliver health services and information. There's a citation there on your slide in this year's American Journal of Health System Pharmacy, which outlines this quite nicely. How might we use smartphones and even things like Bluetooth-enabled medical devices and other kinds of equipment to either deliver information to our healthcare providers or receive information from them? I mean, we do that all the time, right? There's an app for that, and maybe we'll have an application. We already have applications actually to help us do things like improve medication adherence, to improve our understanding of the drugs we're taking, and so forth and so on. So what's telepharmacy? And we're going to define that for you as a pharmacy fundamental here in a few minutes. But I want to do this in the beginning by giving you an example. So there's a thing called the North Dakota Telepharmacy Project that is run through North Dakota State University. And you can see a website there where you can go learn more about this. The state of North Dakota was experiencing a crisis at the beginning of the 21st century. And due to the pharmacist shortage at that time, the availability and access for patients across particularly rural and remote areas of North Dakota to pharmacies was simply diminishing. So they were trying to figure out ways that patients could get access to not only the drug products, but also the pharmaceutical services of the pharmacist. And they created this telepharmacy project. In their project, these pharmacies provide full service. That means they have complete drug inventories, including over-the-counter products, and they provide counseling via telecommunications. They have 53 retail sites up and running, 28 hospital pharmacies that are involved in this telepharmacy project. They service over 80,000 rural patients. So you can see the impact of something like telepharmacy. By the way, the U.S. Navy also uses telepharmacy, and they have over 100 telepharmacy sites on 4 continents. A piece of this that I want us to think about as we think about telepharmacy is, the safety of internet pharmacy practices. So, we know there are lots of internet pharmacy practice sites that are available to patients. Are they safe? Well, I want to describe to you the Verified Internet Pharmacy Practice Site, or VIPS certification, that is done by the National Association of Boards of Pharmacy. They reviewed, by the way, in ABP, over 10,000 pharmacy internet sites. Only 3% of those, as you see on our slide, that they reviewed were in compliance with typical pharmacy practice standards. By the way, for those 10,000 sites they reviewed, about 80% of them dispensed drugs without a legitimate and valid prescription. Over half of them accepted a brief online questionnaire in place of a prescription. Over a quarter of them were operating outside our country, and about half of them didn't show a physical address for the place that they were working. I've seen other data, for example, that tells us that if an internet pharmacy site does not provide their physical address, the chances of you receiving a counterfeit medication goes up dramatically. So what does the Verified Internet Pharmacy Practice Site certification provide? First of all, they assure that we are in compliance with state and federal laws. So in our week on regulatory affairs, we learned about what those were. Is this site, kind of complying with those laws? They must meet the same requirements as a traditional pharmacy. They must review policies, verification of licensure status, and there's an on-site survey that demonstrates that this site is operating appropriately. And then there's a 3-year recertification. So if you see the VIPS seal on an internet pharmacy site, that it means they've done these things, they've gone through these review of policies, verification of licensure, on-site survey, all these things, and that this is good for a 3-year process, and that certification can be renewed. So if you're a consumer watching this video and you're using an internet pharmacy site, I'm looking for a VIPS, VIPPS seal that tells me this is a legitimate site. Let's check our pharmacy fundamentals for this module. Telemedicine is the use of medical information exchange from one site to another via electronic communications to improve a patient's clinical health status. Telepharmacy, similarly, is the use of telecommunication and information technologies to provide comprehensive pharmacy services at a distance. As we go into our discussion forums, I want you to think about this question. I think it's a significant one. How could telepharmacy alter the trajectory for this profession as we move forward? I'll see you next time.